Welcome back to Engineering Acoustics. Hi, this is Professor Ryan Harne. In this video, we'll learn all about hearing health, how it is evaluated, compromised, and how we use statistics about hearing health to guide many decisions in engineering noise control.
So let's get started. It's first important to learn that there are two types of hearing loss. The first is called conductive hearing loss. It refers to mechanical blockage of the ear canal or some sort of mechanical damage to the eardrum. This might occur, for instance, if you poke a Q-tip extremely far back into your eardrum in a very harmful way, and I would discourage you from doing that, of course. The most common form of hearing loss is sensorineural hearing loss, and this refers to damage to the inner ear and often the cochlea and hair cells. So if we take a peek at the cochlea with the tectorial membrane pulled back, what we see at the top are outer hair cells, and at the bottom, inner hair cells. And if we zoom in more closely at this orange box at the top to that set of outer hair cells, we find that in a healthy condition, the hair cells stand up in this V shape and are quite organized and orderly. But when damaged, the hair cells are partially broken, and oftentimes they appear to be fused together. This is sensorineural hearing loss. If the hair cells are damaged, they can no longer transmit the appropriate impulses to the brain, and this is why the sense of hearing is impaired. This type of damage to the cochlea can be caused by a number of factors. One is ototoxic drugs, which means a drug that affects the auditory nerves and nervous system related to audition in our body. Another form of damage to the cochlea could be due to infection, hearing and head trauma, and also just by age. When the hair cells are harmed, they cannot be healed. And when they are harmed enough and killed, hair cells cannot be regenerated. So hearing loss by age, which is natural harm to the hair cells, it's inescapable. Even though hearing aids are in wide use, they're of limited utility to return our hearing back to its natural or original state. So understanding the mechanisms of hearing loss and the risk factors, this understanding is crucial to effective engineering decision-making involving acoustic noise. So hearing loss by age that we just referred to is called presbycusis. This is the term to describe inevitable age-related hearing loss. Even by living in day-to-day sound levels, the hair cells deform and wear down like they are cyclically loaded structures. For instance, a paperclip with one arm bent back and forth many times will finally break, and this is what happens to the hair cells in our ear. These plots show presbycusis for males on the left and females on the right. The hearing level threshold is at the y-axis, and age is the x-axis. The different lines correspond to different frequencies. And what we see is that especially for males from 4 to 8 kilohertz, by the time males reach 50-60 years old, they are statistically likely to lose a significant amount of high-frequency hearing, whereas the same frequencies 4 to 6 to 8 kilohertz for females are less impaired. But overall, what we see from this plot is that there is a steady decline in our hearing level thresholds, whether you are a man or a woman, due to the fact of age-related hearing loss, which is called presbycusis. And again, this is significant because many of these frequencies are central to day-to-day communication and speech. But we can accelerate, unfortunately, our hearing loss due to noise. Long-term exposure to high sound levels overstimulates the hair cells and stereocilia. This is often a concern in occupational environments, such as in manufacturing settings, or if you live in a dense urban environment where there's lots of street noise, vocal noise, and other mechanical noise that's going on. The high-strain cyclic deformation results in early failure of the hair cells at a rate faster than presbycusis alone. This plot shows the influence of noise exposure through the 5 different curves on that same hearing threshold y-axis, although now the x-axis is in frequency. What we see is that with increasing exposure, we have a uniformly reduced capability to hear at all frequencies. But especially from about 1 kilohertz to 6 kilohertz, there's dramatic reduction in the hearing threshold due to exposure to noise. So much so that when you add these levels to the influence of presbycusis, this may explain why hearing aids and other hearing remedies and assistive devices are in widespread use for people over the age of about 50 and 60. This is something that is very important to understand when coming to conclusions in engineering noise control practice. Acoustic trauma can also cause damage to the cochlea. So acoustic trauma is short-term exposure to very high sound levels. We experience this at concerts, sporting events, in loud bars, enclosed spaces, or even just listening to music loudly with headphones and earphones. Acoustic trauma causes temporary threshold shifts, and these are evaluated through audiometric screenings that quantify threshold shifts in terms of decibel in relation to a healthy hearing threshold. So, for instance, if you've ever attended a big football game or exciting concert, you may have left with ringing in your ears. This is a sign that you've experienced a temporary threshold shift. That ringing in your ears is called tinnitus. Temporary threshold shifts do not fully recover. Although after that sporting event or after that concert, we might feel like our hearing has come back to normal after a few days, we've actually undergone permanent hearing loss. And if you experience this on multiple occasions, it does lead to guaranteed hearing loss of a very accelerated rate. So this is something to be very cautious about and protective about your hearing when you're in very loud environments. I would encourage you, for instance, if you do have a work-related need or you're very excited about attending every football game per season, consider bringing along some earbuds to plug into your ears to dampen out some of the sound reaching your eardrum. Head trauma, not just acoustic trauma, but physical head trauma, can also result in sensorineural hearing loss. And this is due to the fact that the extremely large shock waves can damage the temporal bone and cochlea, and potentially even components like the middle ear. Tinnitus is also an indicator that head trauma has occurred, causing a temporary threshold shift. And it is likely that this type of trauma may mostly affect the cochlea on the side of the head that was impacted. And this could lead to asymmetric hearing loss, which is somewhat commonly reported for people who have exhibited a head trauma-related hearing loss. This is a hearing threshold level plot for someone who's been subjected to head trauma on the right side of their head, near their right ear. So what we see here is an audiometric plot in frequency for the right and left ear hearing thresholds. We see that the right ear has a lower hearing threshold. In other words, we have to turn up the sound level even more in order to hear in the right ear, and especially in frequencies 1 kilohertz to 8 kilohertz, have to turn that up more than what we would have to listen to for the left ear. This is a sign of asymmetric hearing loss caused by head trauma to the right side of the head. So how do we evaluate these concerns related to our hearing health? This is called an audiometric screening. It's pretty comprehensive, and it assesses our overall hearing health. It often starts with a tympanogram. A tympanogram measures the compliance of the middle ear by evaluating the resonant behavior at the eardrum or the tympanic membrane. So pressure is applied harmonically at the in a ear enclosed earbud, and it causes a resonance at the eardrum, which monitors the middle ear behavior. A normal tympanogram will have a resonant characteristic with a peak and a valley on both sides of it, whereas a damaged middle ear or damaged eardrum will have a flat or flatter tympanogram. After undertaking a tympanogram evaluation for both ears, you'll undertake an audiogram. And this evaluates the overall health of the inner ear using in-ear and bone conductive techniques. What's shown here at the bottom right is an in-ear evaluation. Very often earbuds or over-the-ear headset is used to send tones to the left and right ears. And then based on how much the tones need to be turned up, that is the hearing threshold level with respect to some reference state of healthy hearing. So in the plot that's shown here, we see that from about 2 kilohertz to 8 kilohertz, both the right and left ears, where right is shown in red circles, left is shown in blue X's. Both the right and left ears have a very high hearing threshold, which means that this patient or this person undertaking the audiogram has significant hearing loss at high frequencies. So this may be someone, for instance, who is more elderly and has presbycusis affecting hearing, or it may also be someone who's experienced noise-induced hearing loss, whether due to acoustic trauma, head trauma, or just loud noise exposures. These audiograms and tympanograms help identify appropriate hearing assistance interventions, such as hearing aids, cochlear implants, and so on. So let's summarize what we have learned. By understanding the mechanisms that result in reduced hearing, this is essential for engineers to address problems of noise. Presbycusis is an evidence that the stereocilia are also mechanical and they degrade in integrity with use over time. But that degradation can accelerate when the stereocilia are more highly stimulated, such as when they're exposed to loud noise for short or long-term durations. Trauma to the head, whether through mechanical trauma or acoustic trauma results in tinnitus, which is ringing of the ears. It also results in long-term hearing loss. Hearing loss is permanent. And audiograms help diagnose our hearing health and hearing loss, and they guide attention to appropriate solutions to reduce this degradation of hearing health any further.
That's it for this video. In the next video, we'll learn all about the essentials of acoustic modeling.